Do you have foot and ankle swelling? I'm Dr. Frita, and today I'm giving you 9 possible causes of swollen feet and ankles you should never ignore. Many people get swollen feet and ankles. Do you? Maybe after a long car ride or after a long day at work when you've been on your feet all day, or maybe after you've been eating a lot of salty foods. So tell me, is getting swollen ankles something serious, or is it really no big deal? I am a medical doctor. I have been board certified in nephrology, internal medicine, pediatrics, and obesity medicine. And I can tell you firsthand that even though swollen feet might seem like no big deal and like an everyday occurrence, it's actually not normal. In fact, some of the underlying causes of foot and ankle swelling are life-threatening diseases. How do I know? Because over the years, I have had many patients who have become deathly ill from diseases that they were first warned about from their swollen feet and ankles. Today, I'm giving you 9 possible causes you should never ignore. Keep watching. Download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. I'm Dr. Frita. Please go ahead and give this video a like and a share as we get started, because I'm about to give you some evidence-based medical information. Number 1, kidney failure and nephrotic syndrome. So you know that your kidneys act as filters. They help to filter your blood. They get rid of excess poisons, excess toxins. They help to balance your electrolytes. And very importantly, they get rid of excess water in the form of urine. Well, if your kidneys aren't working properly, if you have advanced kidney disease or kidney failure, then you could stop getting rid of enough water. This could cause a backup of fluid in your body, which could lead to swollen feet and ankles. Your kidneys are also responsible to maintaining a proper salt or sodium balance. If you are not balanced properly due to kidney failure, you can hold on to excess salt, which can draw in more water, and again, it could lead to swollen feet and ankles. Another function of your kidneys is to act as a protective barrier to make sure that you don't lose important substances from your blood, such as albumin or protein. Your albumin is a very important protein in your blood, and it's a marker for good nutrition. And what the albumin does is it acts like a sponge inside of your vessels, and it helps to keep fluid inside of your blood vessels where it belongs. Well, if you have a problem with your kidneys, especially if it's something called nephrotic syndrome, then you can leak out excess albumin or protein into your urine. This is not normal. It's normal for you to have 0 or very low amounts of protein in your urine. With nephrotic syndrome, there is an issue in that barrier, that filter that is your kidneys, and you're leaking out lots and lots of protein, up to 3,000 milligrams or even more. You're leaking out that protein, and so what happens is that you lose that sponge from your vessels. So if you no longer have a sponge that's helping to keep fluid inside of your blood vessels, well, that fluid leaks out into your tissues, and you can get very serious swelling all over your body, including in your feet, your ankles, your legs, your lungs. It's really a big deal. And so you definitely want to pay attention to having foot and ankle swelling, because it could be a sign of kidney failure or even nephrotic syndrome. Some other signs and symptoms of nephrotic syndrome include a swollen belly or ascites, periorbital edema or puffiness of the eyes. You can also, in some cases, get easy bruising. You might even develop thyroid disease, clotting issues, and some causes, well, diabetes can be a cause of nephrotic syndrome. Also, certain autoimmune conditions like lupus can do it. So just make sure if you're having swollen feet and ankles, take it seriously. Go to see your primary care physician and ask if they can give you a screening test, like a blood test for your albumin level, certainly a kidney screen, asking for a BUN, creatinine, eGFR, and you can get a urine test and ask for a urinalysis as well as a urine albumin to creatinine ratio. Make sure you check out my video on nephrotic and nephritic syndromes after you finish watching this video. Listen, I have a special gift for you. So when I share medical information with you through my videos, my podcasts, my live streams, of course, I'm always giving you information to help you to have your healthiest, happiest lives. But I also have one particular bit of information that I'm very proud of that I'm going to give to you for free. It is a free download of a PDF for my 10 healthy habits for a better you and a better life. These are some of the everyday habits I use to try to live my healthiest, happiest life, and I'm quite sure that they'll be beneficial to you. Just click the link in my description or visit dr.frita.com, my one-stop shop, to get your download for free today. Number 2, congestive heart failure, a pumping problem. Yes, congestive heart failure, or CHF, is a very serious underlying cause that can lead to foot and ankle swelling. Here's what happens. Your heart is responsible for many things, but it is your key pump in your body, right? And it's responsible for pumping good old oxygenated blood to your body, okay? And so it's important that your heart contracts properly and that it pumps very forcefully to push all of the oxygenated blood through your aorta so it can get to your body properly. Well, if you have congestive heart failure, then that pump is not working so well. And what happens if you don't have a pump that's moving forward the way it should? Well, you can get a backup, like a traffic jam. And so then blood and fluid can get backed up in your body and it can lead to swelling. Where? In your feet, your ankles, your legs, your lungs, your arms, your stomach. You can get swelling. And it can start off in the feet and the ankles from having congestive heart failure. Well, we know that heart disease is a leading cause of death in the United States, and congestive heart failure is definitely one of those causes. It can be life-threatening. In fact, if you have advanced congestive heart failure, it can lead to abnormal heart rhythms or arrhythmias. So it's very, very serious. Some other signs of congestive heart failure outside of just swollen feet and ankles include shortness of breath. So you can get shortness of breath while you're doing physical activity or dyspnea or an exertion. You can also become very short of breath if you try to lie down flat. So when you're standing up and walking around and you have congestive heart failure, you might get a lot of swelling in your feet and ankles. Well, when you lie down, you might notice, the swelling is going down. But guess what? The swelling goes down because that fluid tends to leave the feet and the ankles and it goes into your body where gravity is, and it ends up in your lungs. And so if you're a person who gets really short of breath when you're lying down flat, and so you have to sleep on 3 and 4 pillows, or even you have to sit up in a chair in order to not be short of breath, that could be a warning sign that you have congestive heart failure. You can also get a lot of coughing or wheezing, or even cough up like a frothy pink sputum or a frothy pink phlegm if you have congestive heart failure. What to do next? Well, if you suspect that you have CHF, make sure that you let your primary care physician know. And if you're having really serious or acute symptoms like chest pain, severe shortness of breath, this is an emergency. Please call 911 or your local emergency hotline. If you have less severe symptoms, like just a little feet and ankle swelling that's not bothering you so much, if you don't have severe shortness of breath, then you can make an appointment with your doctor and perhaps even be referred to a cardiologist in order to treat the congestive heart failure. Either way, pay attention to your feet and your ankle because that swelling could be a warning sign of congestive heart failure. Question: on a scale of 1 to 10, how much do you trust your body's warning signals? Are you the type to pay attention to every little change in your body? Or do you tend to brush things off until they become impossible to ignore? Let me know in the comments. Number 3, liver disease or cirrhosis, when your body's protein factory slows down. Yes, liver disease can cause you to have swollen feet and ankles, and this is how. Your liver has many, many functions. And you know, your liver is that organ that's about the size of a football. It's located in the upper right part of your stomach. And one of its functions is to make a very important protein called albumin. Yes, your albumin does many things, and one of the things it does, as we discussed when we were talking about nephrotic syndrome, is that your albumin acts like a sponge that keeps the fluid inside of your vessels. Well, if you develop severe liver disease, then guess what? You're not even producing enough albumin anymore. And so, of course, this can lead to swelling all over your body, including in your feet and in your ankles. Some other signs of liver disease outside of swollen feet and ankles include jaundice, or yellowing of the whites of your eyes. You can also get yellowing of the skin, yellowing of the hands, a yellowing under the tongue. With liver disease, you can also have easy bruising, and that's because your body is no longer able to clot the way that it should. And so if you bump into something lightly, instead of just leaving a small mark, you might get some heavy bleeding or heavy bruising. Advanced liver disease can also lead to neurological problems or hepatic encephalopathy. It can lead to confusion or even the shakes. It can cause you to have abnormal walking. Advanced liver disease can also lead to chronic fatigue. It can even cause kidney disease and something called hepatorenal syndrome. Liver failure can be caused by many things. You can have something congenital. You can have an autoimmune hepatitis. Excessive alcohol use can lead to liver disease, as well as certain medications and infections like hepatitis B, hepatitis C. If you suspect that your swollen feet and ankles are from liver disease, then here's what to do next. Contact your doctor right away and ask that certain blood tests be run, like a comprehensive metabolic panel, which will check for your liver function tests. If those tests are out of whack, then indeed you could have liver disease. Also ask for coagulation studies, ask for a PT, ask for an INR. You also want to ask for a serum albumin level. Yes, your albumin, that protein, can be checked with a blood test. You should also inquire about imaging of your liver, perhaps through a liver ultrasound. Make sure that you consult with your doctor. Number 4, a blood clot, or a DVT, deep venous thrombosis. This is a dangerous blockage. And yes, it can cause foot and ankle edema. What happens is this: you have lots of veins in your body, in your circulatory system. And if you get a clot that forms in one of these deep veins, then that clot can be very dangerous. One, it can prevent proper blood flow of blood through the vein back to the heart, and this can lead to a swelling. And also, very seriously, if this blood clot breaks off from the deep vein and it travels through the heart into the lung, it can cause a pulmonary embolism, or a blood clot to the lung, and it can be deadly. So it's really serious. Here's what you look out for. With a DVT, with this blood clot, it usually will occur in one leg. Okay? Yes, it's possible to occur in both legs, but the telltale sign is if you're getting foot and ankle and leg swelling in one leg and not the other. Some other signs and symptoms will be, in addition to the swelling, you might have redness of that one leg, tenderness. You might even start to get a redness or a ruddy color of that leg. And again, usually, not always, but usually, one foot or ankle or leg is swollen more than the other. Some risk factors for getting DVTs include if you have a blood clotting disorder, like if you have thick blood or coagulopathy. Many people with lupus, for example, clot very easily. Also, if you've just had a surgery, okay, and if you've been sedentary, that can increase your risk for having a blood clot. If you've been on a long car ride or a long airplane ride where you haven't been up moving your muscles and pumping those veins around, well, that could increase your risk for having a deep venous thrombosis. Also, if you've had cancer, having cancer can increase your risk for getting a DVT. It, in some people, can make your blood be rather thick and make you clot easily. Living with obesity is another risk factor for getting a DVT. These are just some of the risk factors, not all. If you suspect that your foot and ankle swelling is from a blood clot or a DVT, here's what to do next. This is a life-threatening emergency, and so I recommend that you call 911 or get to the emergency department as soon as possible. This is life or death, and I'll tell you why. I've actually lost patients who've had blood clots. I'll give you one example. A young patient of mine, a young man in his 40s. He was a husband, he was a father, he was a working man. He was hilarious and he was a delight to have as a patient. Well, he and his wife called the office because he was having swelling in one of his legs and he was also having some shortness of breath. And so, of course, I told him, hey, call 911, get to the emergency room right away to evaluate what this could be. Well, he didn't go to the ER. His plans, I believe, were to perhaps go the next day, sleep it off, try something else. At any rate, his wife ended up calling the office the next day because he passed away. And he passed away because he had a very large blood clot. He had a DVT that dislodged and it became a pulmonary embolism and it took his life. So when I tell you that having a blood clot in the leg is an emergency, this is not hyperbole. It's something I've seen. It's something that is potentially life-threatening and also potentially very treatable and manageable. So again, foot and ankle swelling is not always just some everyday benign thing. It can be life-threatening because it can be a warning sign that you have a blood clot. Number 5, chronic venous insufficiency, leaky valves in your veins. This is actually a very common condition, and it tends to occur in people who are older, over the age of 50. And what happens is this. In your veins, you have these valves, these one-way valves that help to push blood back up toward the heart so that it can get oxygenated and then go on to the rest of the body again. Well, if you have leaky valves, then instead of them pushing the blood back to the heart like they should, well, you get a backup of blood, and this tends to cause an issue where you can get a venous stasis. And so initially, you might just kind of have weak, achy legs, and perhaps no one can really even see what's going on. But as the chronic venous insufficiency progresses, you might develop spider veins and varicose veins. And then you might actually get swelling where you can even get these really thick ankles that kind of hang over the edges of your shoes, okay? You can get swelling. And you can also end up getting ulcers, okay? You can get these venous stasis ulcers and a change in the color of the skin, a thickening of the skin, a ruddy skin. So this is chronic venous insufficiency. It's very common. It is benign. And risk factors, again, being of an older age, over the age of 50. Also, if you're a person who is living with obesity, or if you have a sedentary lifestyle, or if you have a family history of someone with chronic venous insufficiency. At any rate, if you have swollen feet and ankles, one of the causes could be chronic venous insufficiency. What to do next? Consult with your doctor. There are many levels of management. The chronic venous insufficiency in and of itself, fortunately, is not life-threatening. It can be managed by elevating your feet, okay? Getting your feet off of the ground. That can help to decrease the swelling in your feet and your ankles. You can also wear compression stockings to help to prevent you from having all of the swelling. And there are certain surgical procedures that can be done in order to help as well. Of note, sometimes patients who have had blood clots or DVTs can have a post-thrombotic syndrome, which can lead to a chronic venous insufficiency as well. Number 6, peripheral artery disease, PAD, clogged supply lines. Now, this is an interesting one because we typically think of venous disease as causing swelling, and it does, because we know that veins are responsible for taking blood back to the heart. And so if you get a backup in that system, then yes, you can get swollen feet and ankles. But also, your arteries are responsible for supplying blood to your organs. And so even though it's not a hallmark sign that we typically think of, peripheral artery disease or clogged arteries can also lead to swelling. So here's what happens. If in the legs, for example, you have a blocked artery, okay, like if you have atherosclerosis or some kind of a clot or a narrowing, and it's causing you not to get enough of a blood supply to your legs, well, you can certainly get claudication or cramping in the legs. You can get pain in the legs. You can get a coolness from a decreased blood flow to the feet. It can even cause a blueness or a cyanosis in the feet just because you don't have enough of a blood supply. But guess what? it can also cause swelling. And so if you see swelling in your feet and ankles, don't just think that it could be a vein problem. It could also be clogged arteries or peripheral vascular disease. What to do next? You definitely want to consult with your doctor. Ask for vascular studies. And so you may be referred to a vein specialist, an artery specialist, or a vascular surgeon. Ask them to do studies where they can check to see if your arteries are open or not. If you have a narrowing or if you have plaques, then you could have peripheral artery disease. And yes, there are treatments. There are some non-invasive treatments where the arteries can be opened. There are also some surgical procedures. Either way, if you're having foot and ankle swelling, think PAD because you could have peripheral artery disease. Number 7, lymphedema, a plumbing problem in your lymphatic system. Okay, so we've talked about your veins as being responsible for carrying blood back to the heart, where you also have a second parallel system in your body called your lymphatic system. And your lymphatic system is responsible for going through almost like a sewage collection, getting rid of excess water and helping to drain it from the body. Well, if you have a damaged lymphatic system or just a lymphatic system that's not working well, then you can definitely get a buildup of fluid and it can cause foot and ankle swelling. You've seen a celebrity with lymphedema and she's been very open about it. Wendy Williams. Yes, she has a diagnosis of lymphedema. She's talked about it on her show back when she was doing the Wendy show. She also talked about it on that series she did, the docu-series, Where is Wendy Williams? And you will note that lymphedema can cause a very big heaviness and swelling in the feet and the ankles and the legs. It can even cause a thick skin or a discoloration of the skin. It can cause a numbness and a tingling in some cases. And so it's a problem. If you suspect that your swollen feet and ankles are coming from lymphedema, here's what to do next. Of course, consult with your doctor, and this will take a specialist in most cases, like a vascular doctor. Some treatments include wearing compression garments or even having special massages like manual lymphatic drainage. Also, physical therapy in some cases can be helpful in order to help to move about and to function in a way that is proper, even with the lymphedema. Be sure to watch my 6-part series on what's happening to Wendy Williams' health after you finish watching this video. In one of the parts, I go into detail on lymphedema, what's happening to Wendy's feet. Number 8, medication side effects, an unexpected consequence. Yes, it's true. Sometimes your swollen feet and ankles can be due to medications. Certain medications can cause swelling, such as blood pressure medications like amlodipine and nifedipine. These are calcium channel blockers. Other meds that can cause swelling include steroids. Also, some diabetic medications can do it, and some pain medications like NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen. If you suspect that your medications are causing you to have swollen feet and ankles, please do not just stop the medicine on your own without consulting with your doctor. No, I recommend that you consult with your doctor, give them a specific list of the medicines that you're on, ask for alternatives. If the medicine that's causing swelling is one that you really need to be on for whatever reason, then sometimes your doctor can offer you a water pill or a diuretic to help to get rid of the swelling. Either way, please don't be your own doctor. If you discover this, great. If this video helps you to discover it, wonderful. But please partner with your doctor. That's what you do next. If you suspect that your foot swelling or your ankle swelling is due to medicine, consult with your doctor and find out some medication alternatives or some treatments. Number 9, a high salt diet. This is one of the most common reasons for swollen feet and ankles that I see in my office. And you know what? I almost don't even feel like explaining this one because you know, don't you? You know that when you have high salt in your foods that can lead to swollen feet and ankles. But come on, let's go ahead and talk about it. So the principle is easy. Where salt goes, water follows. And so if you have a diet that's high in salt or sodium, then that's going to cause water to follow, and it's going to make you retain fluid, and that fluid can show up in your feet and your ankles, okay? It can show up as foot and ankle swelling. The high salt diet can also cause other issues, namely high blood pressure, which we know is a leading cause of heart attacks, strokes, and high blood pressure is the second leading cause of kidney failure. If you notice that you have foot and ankle swelling and you suspect that it is due to your high salt diet, here's what to do next. Well, please watch your diet. So if you are eating a diet that's high in ultra-processed foods, please try to cut back. If you're eating foods that are fried foods like French fries, fried fish, fried chicken, if you love yourself a good burger loaded down with salty condiments and with cheese and that high salt food, please cut back on that. Even if you eat frozen food, you want to do something healthy and you have a frozen vegan meal or a frozen low-calorie meal, you still want to be a label watcher because it could be high in sodium. So yes, you want to watch your sodium. According to the American Heart Association, it is recommended that most adults take in no more than 1,500 milligrams of salt or sodium a day. And so what you want to do is to be a label watcher. And of course, consult with your doctor if you are having foot and ankle swelling, and share with your doctor if you suspect that it might be due to your high salt intake. Question: which of these 9 dangerous causes surprised you the most? Please comment down below. So there you have it. These are 9 of the common and serious causes of foot and ankle swelling that I see in my office as a practicing physician. So remember, there are certain telltale signs from when the foot and ankle swelling is something that could be something that you can watch and wait versus when it's an emergency or more serious. If you have foot and ankle swelling that's on one side more so than the other, remember, that could be a blood clot, life-threatening. If the foot and ankle swelling is accompanied by other symptoms like shortness of breath, swelling of the eyes, if it's associated with easy bruising, this could be, liver disease or congestive heart failure. Again, very serious. The most important thing to remember is that you don't have to be your own doctor. There are those of us who are out here and we choose to be doctors. We love it. So make sure that if you notice foot and ankle swelling in yourself or in a loved one, share this video, be your own health advocate, and help to advocate for those that you love. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. Also, if you have not done so already, make sure that you subscribe to my channel because that way you'll be one of the first to know when I release new medical content. And certainly make sure you join me every Monday for my live stream at noon Eastern Standard Time, where I talk about celebrity health and all of the hot health topics in the headlines. As always, I appreciate you for your support. I appreciate you for watching, and I will see you next time. I'm Dr. Frita.